everyone, welcome to Kidsstoppress.com, and we're really excited because today we have with us Dr. Kiran Coelho, who's head of Department of Gynaecology at Hinduja Hospital and the Lilavati Hospital. Dr. Kiran, thank you so much for talking with us today.
Thank you, Mercy. It's nice to be here.
Right. What are the 3 or 4 toughest or the most complaints that you get from moms?
Well, first of all, it's been very enjoyable looking after, not stressful at all, looking after pregnant women, and I've been doing it for 35 years now. And I think, in each trimester, there are different set of problems. Like in the first 3 months of pregnancy, they are really miserable because of nausea, vomiting, cravings, etc. And then the good part comes. And then after the first trimester, the second and third trimesters are a breeze, because that's the time a woman is healthiest. She has a good complexion, good appetite, and it's a wonderful period. And then, of course, there are so many problems which can happen during that time, because some girls unfortunately develop diabetes, some develop high blood pressure, and nowadays everyone's having their babies when they're much older. So they have more problems than would be when you have your babies younger. So if you wait too long and have your babies by 35, 36, then you're more prone to get maybe preterm labor, multiple pregnancies, diabetes and hypertension complicating. So that is the reason I always encourage everyone, have your babies younger.
Of course.
Most girls are worried about their body, their figure. That's point number 1. Their stretch marks, that's another thing. Are they going to be able to get back to their pre-pregnant state? Not only physically, but also most of them are professional, and they need to get back to their work. And India is notorious for not having good care, child care later, and you wouldn't want to. And nowadays we don't have joint families, we have nuclear families, so there are so many fears as will they be able to go back to their work? Number 1, will they get good domestic help? And you can't have an untrained domestic help taking care of your child. And you may not have your mother or mother-in-law to help you out. And so many girls try to delay their childbearing because of that.
What should I eat and do, and how should my lifestyle change before I conceive? And what should my diet and lifestyle be after I've conceived? So if you can answer.
Sure. First of all, you have to be healthy before you conceive. So your BMI should be normal, you should not be overweight for your age. You should be physically active, doing at least 30 minutes of good exercise every day, 5 days a week at least, and eat sensibly even before. Because you can't start off with diabetes. You can't start off with being overweight, because during pregnancy there are certain physiological changes which will occur. So basically, then give up smoking if you're a smoker. Alright, minimal amount of drinking. And smoking, I find, a drink a day is perfectly alright, but it's the smoking which is really bad. Number 1, smoking, and many girls smoke today because they smoke to keep their weight down, and it works the other way, because when you do get pregnant, you have to quit cold turkey, because cigarette smoke and nicotine causes malformations of the baby, poor growth, and death of the baby inside the uterus. So no smoking, and that is even for passive smoking. So husbands also don't have to smoke in the house. So give up all these habits, then detoxify, and then get pregnant. And during pregnancy, first trimester, anyway, you can eat whatever you want, because most of the time you don't feel like eating. But it's after that, starting from the second trimester onwards, that you have to meet a dietitian, get a good balance of proteins, carbohydrates, and minerals, vitamins, calcium. No sweets, no cakes, no pastry, no spicy food, and less salt.
You're asking us to give up too much.
I know, but then think of all the healthy things you can eat. Plenty of fruits, salads, vegetables, nuts, you can have meat, protein, whatever. You can eat well, frequent small meals, because you can't have big meals. And then once you eat sensibly and diet, and there are a lot of those prenatal exercises that one can do, which keeps your weight down. So this is the advice. And then postnatally also, the same good diet. You don't have to eat for 2, and that's a myth.
That's the biggest myth that I think
the biggest myth is that you don't have to eat for 2, but you eat sensibly for 1, of course.
And also for lactating moms, would you recommend, because we have the traditional way of parenting, which is my mother said this, that I have to eat the laddus, and I have to eat this, and I have to eat that. So any of those that you want to just address and say, that's not required, this is what you should technically.
Absolutely, and I catch out of all the mothers and mothers-in-law and tell them, no ghee, no laddus, no sweets, nothing after the delivery, because our good Indian diet is good enough for milk. You don't have to have those. And invariably after the delivery, the first 40 days, you have a lot of acidity.
Right.
And then you add to all those laddus, etc. And you're not feeding a cow, to make her give more milk. You don't have to feed so much, make the mother eat all this. And there are so many myths and taboos in different communities. Someone says don't eat potatoes, someone says don't eat onions, someone, some of them give them only gruel kanji for the first 40 days, there are certain, so there are so many myths. Eat just the same as you were eating in the pre-pregnant stage, your normal diet, and don't splurge.
Right. Dr. Coelho,
and spicy food, because spice comes out in the milk, so when you're breastfeeding, take care.
Right. Also, one question that some people's continued nausea and morning sickness feeling continues for a really, really long time. In your experience, one thing that just works wonders.
And I would say positive attitude, maybe change of place, go to your mother's house, or then you go to your, you go for a holiday, and that takes your mind off. But there are some girls, it's unfortunate that they have pregnancy related vomiting throughout, and some have hyperemesis, but not all.
Dr. Coelho, also a lot of moms often ask us, what's the right weight to put on? Because they're always so worried about the weight.
Absolutely. For the average Indian woman, 7 to 11 kilos in the entire pregnancy. Out of which, the first 3 months you lose weight, then you're static right up to 20 weeks, that's the 5th month, and only from the 5th month will you put on ½ kilo per week or 1 pound per week till the 9th month. Then 9th month you're static. So that would be 7 to 11 kilos. Less than 7, very poor. That means the baby is not growing. And more than 11, you're putting on too much. But some girls do put on, if you're taller, then you'll put on 13, 14. Now it's not all the baby. The baby would be, say, 3 kilos. The fluid will be, the placental fluid would be 1 kilo. Placenta would be another ½ kilo. Water retention would be another 2 kilos. So when you actually deliver, you have an instant weight loss of about 5 kilos.
Yeah, I remember. I remember. I immediately delivered and I said, I want to check myself.
And it all comes out, And then again, another 40 days, all the water retention goes. And then after that, you go back to your pre-pregnant state.
Awesome.
Of course, two things. I would say, definitely body, as I told you. Another thing is stretch marks.
Right.
Everyone, and so many girls say, they compare their tummies and say, so and so has stretch marks and we don't have stretch marks, etc. Right from the beginning, you have to use an emollient lotion on your tummy.
Right.
Because that prevents drying of the skin, and when there's a sudden stretch, the skin is already emollient, so the scars are minimized.
Right.
So using a good oil or a cream, which suits your skin right from the beginning, from the time you're pregnant, not only on your abdomen but breast and arms and everywhere, and even otherwise in winter weather, even non-pregnant women can use, makes the skin supple, emollient, and prevents the stretching. Of course, you can't prevent it altogether, but you can definitely minimize. So that
question of milk is not enough. It's like it keeps coming back. Right?
It's a myth. Every woman who has a breast can breastfeed. It's all in the mind. Even if you have small breasts or you have large breasts, you can. There is something that if you suckle the baby, there's a stimulus and the milk gets done. But the letdown is on the 3rd day. So that is why the first 48 hours is only colostrum, and that's the time which is you're so demoralized.
Right.
Because then your baby has to depend on something else, and that's how everyone, your mother and mother-in-law is saying, why are you not producing milk, and that,
that kind of psychologically affects you a lot.
Absolutely. So that you must have a lactation consultant who comes and encourages these new mothers to breastfeed.
Sure.
And they have lovely society where other mothers who are breastfed then give encouragement to them.
Yes. Yeah. Dr. Kiran, thank you so much for talking to us.
Thank you, Mansi.
It was an absolute pleasure.
Thank you.